Day 6, clinical scenario task number 4. So the scene is as follows. Mrs. Timoshenko is a 49-year-old patient in the surgical unit. She has had abdominal surgery, herniectomy. So when she's returned to her room from the surgery, you note that she has an intravenous feeding running, dressings on an abdominal incision, and elastic stockings. NPO sign is on the bedside cabinet. You note the body temperature is 36.2 degrees Celsius, pulse is 84, blood pressure is normal, that is 120/80 mercury millimeters. Wound dressing is clean. Urinary bag contains 120 milliliters of normal urine. Patient is conscious. Complaints of dry mouth and thirst. You've offered the patient to drink a couple of carbonated water glasses. And the questions are as so question number 1, what is herniectomy? So this can actually be broken down into two words, that is hernia and ectomy. So hernia refers to the condition, this is the name given to the condition when an internal part of the body pushes through a weakness in the muscle or surrounding tissue wall and protrudes outwards. And ectomy refers to the surgical removal of a specific part. So herniectomy refers to the surgical operation that is done to remove a part of the body which shows hernia. So the second question is, how much urine do you expect during the next hour? So because an NPO sign was found, the patient's nutrition is probably mostly given through TPN. So in the next hour, we can expect about 200 to 300 milliliters of urine because the fluid content of the body will definitely increase. So the next question is, what does NPO sign? NPO sign actually stands for nil per os, which means nothing through mouth. So this is indicated in the cabinet of patients where the gastrointestinal nutrition is contraindicated due to different diseases or reasons. So in this case, probably TPN, that is total parenteral nutrition, is the most common way of giving nutrition. NPO is the standard instruction for people usually preparing for medical procedure or surgery. The next question, are the actions of the nurse right for dry mouth and thirst? So in this case, the nurse has offered the patient to drink a couple of carbonated water glasses because the patient complains of thirst and dry mouth. So this is probably not a good idea because after a surgery, it is not good to increase the fluid level of the body because due to residual anesthetics, this may encourage vomiting and nausea. So post-operative oral hydration is actually withheld for about 4 to 6 hours after general anesthetics are given. And the last question, what should you have done for dry mouth? So in this case, the best course of action that can be taken is to actually use a humidifier that adds moisture to the air that the patient is breathing. Also make sure that he or she has good ventilation around him. And for the dry mouth, you can use a moist washcloth and gently scrub around the lips, but drinking a lot of water is not a good idea. So in this case, the actions of the nurse were actually wrong. Thank you.